Disclaimer, I'm not an attorney, I'm not a medical doctor, just a theology maybe a little bit, but this subject is an interplay of all three of those subjects because you're dealing with that world when you're dealing with end-of-life issues in hospitals, etc. And so with that disclaimer, I'm going to try to go through this discussion and talk about the church teachings and how decisions are made and what the principles are. And I'll intersperse that with personal experiences that I think highlight some of the principles that I've experienced firsthand myself or somebody might have told me about, but most of them firsthand. You'd like to think that the church teachings are simple, basically respect life and you avoid sin. Well, end-of-life issues can make that simple, those simple words sometimes a real challenge. I mean, we all know you don't kill, you don't steal, but when you get to the end of life and you try to follow these principles, it's a little bit more of a challenge sometimes. So we're going to try to talk about how to implement these church teachings, even though they seem obvious. Respect life. Obviously, the first question is, well, what is life? Well, in the church teaching, it starts at conception and ends at death. Not everybody shares that, but obviously that's our teaching. And medically speaking, medicine doesn't know where it begins, and the truth is we don't know where the soul is interjected. Only God knows that. And so it's really smart to say conception because we don't know, and to assume otherwise would be really wrong. And so we think of end-of-life issues as being when you're old and you're in the hospital and you're ready to pass away. But end-of-life can start right at the beginning. One of the issues sometimes is, and when I say end-of-life, that's a natural death in Catholic teaching, not something that's been imposed. But one example of early end-of-life is in vitro fertilization. Couples can't have children, and so they sometimes have decided to do in vitro fertilization, which means that the doctor will take the semen and the eggs, and they'll fertilize more than one egg. They'll fertilize 10 or 12. Then they implant one, and they do 10 or 12 in case one fails. They implant one, and if it works, the other 10 or 12 are either destroyed or frozen and used later, or sold. Now these fertilized eggs have been conceived. That's life. So Catholic teaching would say you don't do in vitro fertilization for that reason. So that's a little twist on this that some couples are faced with, and it's end of life for the fetus. Now, we talked about respect life and avoid sin. Well, a lot of times in a lot of Christian denominations, don't have the Catholic teaching that we have. A lot of Christian denominations will say, well, if a person commits an immoral act, then they have sinned. Well, that's not the Catholic teaching. The Catholic teaching is three things are required for a sin. One is the act or omission has to be morally wrong. Two, you have to have full knowledge. And three, full freedom. Now, and so a person may commit a morally wrong act, but we can't say that person sinned because only God can decide whether a person has full freedom or full knowledge. As humans, we can decide what's morally right or wrong. In fact, we're obligated to make that decision. But in terms of whether that person sinned, only God can say that, because only God can climb in that person's head. Now, an example of this And you might hear some of the things that I talk about that were in homily, so bear with me if you heard it twice. But I was called by a lady who I taught RCIA to at St. John Vianney to come and minister to her father. And she and her daughters had converted. That's how I knew them. And I said I'd be happy to. And then she said, well, I want to let you know that my father's an atheist. So I said, well, I don't want to force myself on him. That wouldn't be appropriate. And she said, oh no, he wants to do this for us. So I go in, and they were distraught because he was dying in the house. And I taught the children and the daughter, his daughter and his grandchildren, centering prayer, and they needed some peace in their life because they were completely distraught. Then I went in to see him, and I was praying the whole way, what am I going to say to this guy? So the first thing I said to him was, I'm not here to convert you. And his answer was, you couldn't do that anyway. And I said, good, as long as we know where we stand right up front. And it turns out this guy was a medical doctor, and he was the top medical specialist in his field in the world. He had done tremendous good for people. So we talked, and I taught him a form of prayer without mentioning the word God. Don't ask me how I did it. I mean, I was praying the whole time the Holy Spirit would guide me. And then at a certain point I said to him, you're doing this for your grandchildren. It would give them a sense of peace if you told them you would see them after you die. They would see you after you die. And he said, I can't do that. I don't believe it. And I said, I apologize. I am so sorry, because that was wrong for me to ask you to do that, because to do something that violates your conscience is wrong. Now, I didn't give him the side view because you're ill-informed. I mean, just that was true. So I said, I am so sorry. I should have never asked you to do that. Now, we left. 3 months later, I was asked to come back, and this time I prayed with the whole family over his bed. And by this time, he was starving himself to death. Because he knew the death he would, the painful death he would incur by dying of a cancerous brain tumor. And so he had stopped eating and drinking. He wanted control. Now, Catholic teaching says, kill yourself that way, okay? But that's not where he was at. So I called to pray in silence and centering prayer, and suddenly his eyes opened wide. He was flat on his back, all his hair was gone. And his eyes opened wide, because at that moment he realized that what I had taught him earlier was a form of prayer, but I didn't mention God. And the kids, his grandchildren, his daughter, knew what this was. So we prayed in silence for 10 minutes, and I at the end, I said, and I was praying the whole time, I said, it doesn't matter what you believe. God's going to be there for you anyway. Now, what I meant by that was, it doesn't mean that, atheism's the best thing, but what it meant was that God was going to be there for you, whatever. He's going to be there for you. In other words, you get another shot at this. I wouldn't give up. He sat up in bed, looked at me startled, and I thought, oh, what did I do? So he left. You might have heard this a little while. So I left, and I was project manager on the project in Israel, and I get a call on my mobile phone. She didn't know I was there, but the daughter calls me. It was a right 8-hour differential. I picked the phone up, and she said, I am sorry to tell you, but he passed away. And she said, I wanted to, and I never told her about the conversation about seeing his grandchildren. And she has since given me permission to tell the story without mentioning names. And she said, I want to tell you that he started to talk about wanting to see his father who had predeceased him after he died.
Can you talk a little louder at that air conditioner?
I know exactly. May I suggest you come up here, but not under that air conditioner?
No, that's turn one down.
I find if you don't sit right under it, you can hear.
Okay, that must be why.
And that way we can
Nice
hear.
is much better here.
It might be better.
Yeah, right here.
Circle up closer if you'd like. You can set it over and you see her up
I was
close.
here in this
Am I
room
the only
yesterday,
one, or?
and that's
No,
exactly where I was
no.
sitting, and it's horrible. You can't.
You were brave enough to say yes.
Move it on up.
Here, you want to sit over here?
You wanna, somebody could sit.
So, she said that he was starting to talk. Can you hear me when I?
I couldn't over there.
Here, why don't we move this chair up? Why don't you sit up here? Okay, then you can't move. And she said he started to talk about wanting to see his father who had predeceased him after he died, and his dog who predeceased him. And right away, the light goes off in my head. I knew what that meant. She didn't quite understand that. So what happened here? Well, this guy didn't have full knowledge, and in his condition, he didn't necessarily have full freedom. Who's to say how God would treat him? I think God would treat him with immense love. So as Catholics, even though we wouldn't agree with the decision to starve yourself, that doesn't mean that he sinned. Okay. Now, he didn't have full knowledge in my view. Okay. And the other thing is he said to her he wanted to see his sister, who he hadn't seen in 15 years, and he called her to his bedside. And she was a Baptist minister. Now, there are some Baptists that are fundamentalists, and there are some that aren't. But his daughter said he converted when she came. And what converted means, I don't know, but he believed in God, and he was at peace knowing that he was going to have someplace to go. Can you hear me? Good. So, an amazing story. Now, some denominations will teach that you have to accept Jesus Christ as your Lord and Savior, or you go to hell. So I could envision he may have been told that before, and he, being a smart man, he rejected it. And what I was saying to him is, doesn't matter. God's going to be there for you. And so you never know what's going to happen. So he didn't have full knowledge. A young man who was the son of a parishioner had bipolar condition, and people who have bipolar condition quite often take lithium. Lithium is it's not an organic chemical, it's a salt. It was invented by the Greeks, and it's come back now. And the LD50, which is the lethal dose that kills 50% of the population, that's what scientists talk about. The LD50 is that's the dose where you're going to die if you take too much of it. Is very close to the therapeutic dose, so it's a very difficult drug to manage. It helps a lot of people, but they got to be careful. Their son overdosed. From all outward signs, had committed suicide. How do you know? Full freedom. Maybe full knowledge, he may not have gotten it right. Full freedom, he may have been so distressed over that depression that he couldn't make that decision. So God's going to take care of people, you know. You don't have to worry about this. Okay? But that's an example of having fallen in that category where we let God make these decisions. And so having talked about life and sin, which, get past that, we have several ways of making moral judgments. Okay. One is just, does it feel good? Well, I don't want to make this trivial, but obviously our conscience guides us and the Holy Spirit dwells within. But it's not just feeling. That can't be the only thing. You've got to use reasoning to a certain extent. And so to just rely on that can become very subjective without any objective codes to live by. And that's not necessarily what the Catholic Church will teach. The second would be prescriptive. You do this, this happens. Now, during the Dark Ages, when people couldn't read or write, they would go to their priest and say, you know, is it okay if I do this or I do that? And so the priests were trying to be good to them, and so they started to put together a menu of what you could do and what you couldn't do. And they published it, and it was called the Penitential Books. Well, this can be rather dangerous too, because you get into that mode where if I go to church on Sunday, and if I don't eat meat on Friday, back then, I go to heaven. And in a sense, that feeling approach leads you to the same place as the prescriptive approach, or can. And that is, you don't have to love. If it's subjective, it's all me, me, me. If it's overly done, extreme. And if it's extreme prescriptive, you don't have to love. You just follow the rules. Well, fortunately, the church started to get away from that. They're away from it now. They don't believe in that penitential books. But what they do now is based on a principled approach, using faith and reason. And today we're going to talk about that principled approach as to how do we approach things that way. First, I would like to talk about the things that are available to us to help people, okay? Or what I'm calling here is available means. The ordinary available means would be food, water. You want to give people shelter. You want to give them clothing. This is human dignity that we're talking about. That's the bare minimum. And so, by ordinary, I don't want to make it sound like, you know, there's nothing to this. That's actually what's ordinarily the norm. That's the ordinary norm. And human dignity dictates that we do that. Extraordinary means are the things that a lot of them are based on technological advancements. Okay? Now, the church doesn't use ordinary, extraordinary much anymore in terms of terminology. But there is that understanding that there are certain minimum things you've got to do for somebody. And if you withhold them, that's not right. Okay? So, what does the church lead to then? I would call them prioritized rules, if you will. In a homily I gave recently, I talked about 3 of them. And in a 12-minute homily, you can't go through everything. Okay? So this won't match exactly, but it's actually, there's a 4th rule I added. Rule number 1 is ordinary human dignity. In other words, you got to give them food, you got to give them water. You know, you can't put them out on the street. You can't in the cold. You know, now that seems obvious, okay? But I'm calling these prioritized rules because each rule cannot be superseded by the next rule. Okay? The next rule is don't intentionally kill. Well, if somebody doesn't have the intention to kill and withholds food, they violated rule number 1. So rule number 2 is okay, with one exception. You can't violate rule number 1. Okay? Now, a good example of violating rule number 1 is the atheist that we just talked about. He violated himself, on himself. And that you can sin that way too. It's not always against somebody else, it's against your own humanity. But he didn't know it. Okay. So, now as far as, I think that on this rule number 2, the operative word is intentional. I think that's an important word. I'll give you an example, and I did this in a homily, so bear with me if you've heard it before. But my mother had, our mother, it's my brother back here, had a stroke and was paralyzed on one side. And So I had a discussion with her. And a discussion went something like this. And by the way, I think this kind of discussion has to take place with everybody's children. Can you hear?
Yes.
If you want to move up to
No, I'm good.
And it has to take place with everybody's children. And that's why I'm going to get my kids in a room and say, we're going to talk about this. So I've failed at this too. I mean, you know. So I had this conversation with my mother. And it went like this. And that is, let's talk about a scenario, Mom, that could happen. You're paralyzed, you're walking, and you fall. And you break a hip. Sound familiar? Then they put a catheter in you. And then you get an infection from the catheter. Classic. Do you want us to give you antibiotics? The answer was no. Well, I gave an example of this to her of Jacqueline Onassis. Jacqueline Onassis had an illness that caused infection too, and it was not a pleasant death if you follow through with that. She chose the same thing, and that was to not give antibiotics. Now, antibiotics is not food and water.
Is that not considered, excuse me, extraordinary? Is it considered extraordinary?
It's something you can exclude, and I'm going to get into how you make those judgments. But I'm giving you an example of how a decision was made, and we went forward, okay? Now, the third rule is you honor patient's wishes. Now, Rule 3 cannot violate Rule 2 or Rule 1. So my mother said, I don't want antibiotics. You can't force somebody to take drugs. You can't force it. It would be wrong to force it. And she wasn't intentionally killing herself. The antibiotics, what was killing her would have been the infection, not the antibiotics. So if she had the intention, and we discussed this when we talked, if she had the intention of dying as a result of not taking antibiotics, that wouldn't be right. Now, I realize this is a subtle psychological thing, but if her intention is saying to God, God, I'm in your hands, I'm not going to take any more steps. This is up to you, and if I do die, I accept that. But I'm not doing this to kill myself. Okay? And that's important. I mean, you don't do it with that intention. It gets back to that operative word, intentionally killing yourself. Now, she had suffered with this paralyzed state for 8 years. She had lived a full life, and I'm not going to force her to take antibiotics. Okay? So, we get into the nursing home. And we had, and I'll get into this in more detail, but I'm just giving these quick examples. We had signed a do not resuscitate. The doctor signed it with us. And there are levels of do not resuscitate. We're going to get into that, but just follow me with this example. The nurse violated the do not resuscitate and administered antibiotics, even though we told her not to, even though we were on record. The nurse violated Rule 3. But she didn't know that. So I talked to her about it, and she said, but I love your mother. I'm doing this because I love her. And I said, we love her too, and we know what her wishes are, and you're violating her wishes. So misguided and misdirected love is a risk if it's not thought through, okay? And so it was a very difficult decision for us to then stop the antibiotics. But morally, it was no different than not giving them in the first place. But psychologically, it's a tougher decision because you're going, now I got to stop this. Okay? So it's not pleasant to make some of these decisions. Now, I'm going to give you rule 4, and that is minimize the patient's suffering. Now, you should do number 4, but it can never violate 3, 2, or 1. So, our father was dying of a condition that caused him to not be able to urinate. And so the uric acid built up in his system. And so, in an unusual circumstance, it was absolutely predictable that he would die within 24 to 72 hours. Because it reached the point where your body can't handle it. So it was absolutely possible. The night he passed away, I left the room and said to the nurse, he's suffering. Please give him some painkiller. She does. My dad calls me and says, why did she give me that painkiller? I didn't want that painkiller. I want to be conscious for my death. I want to experience that movement to the next life. We were trying to follow Rule 4, and we violated Rule 3. I violated it, and the nurse who gave the injection should have said something. We want to do this, but this was some years back, so, they're not as pros about it. And nowadays, they don't violate the DNR as often. So the question seems pretty straightforward. I mean, some of these examples. But making decisions on specific things that you can do or not do can be a challenge. And that raises the whole principle of the double effect. In life, very few things have just one effect. You get multiple effects. And so you're making moral judgments on multiple effects. I'll give you an example. When we had this discussion with the doctor, for my mother's doctor, we tried to get a Catholic doctor. We did get a Catholic doctor who understood the teaching. But actually, it's not too different than most doctors would do anyway. Okay? And the conversation went something like this. We don't want her to suffer. Rule 4. We want that suffering minimized. Now, just as an aside, there's a difference between pain and suffering. You can suffer and not have pain. It can be psychological, it can be a lot of things. But in the simplistic approach, when somebody's dying, you shoot for the pain and then pray with them to give them some peace of mind so that they don't suffer. So right now, I'm saying we want to reduce the pain so that the suffering is reduced, which is not always the case. How far will you push the narcotic to keep her from pain? Because narcotics suppresses the breathing. And pretty soon you can reach a point where that actually kills you. Now, doctors are smart. They're not stupid. They know that they are not legally allowed to do that. But we had that conversation with him anyway. And he had the reaction that we had, and we were at a like mind. And that is, I'll push it right to the edge, but I won't take her life. So, here you had a drug that was going to follow Rule 4, but you didn't want it to violate Rule 2. I think logically is my problem. But and so you don't. This is why euthanasia is wrong, because you don't decide on your own that you're going to kill somebody. It violates rule number 2. This is why you cannot intend to kill a mother to save a child. Okay. I'm not saying that these are easy decisions, but I'm talking about principles here. What are some of these, some of the things that can happen? I was in the recovery room, and a family of an ethnic origin, a strong ethnic origin, and they weren't that educated, had their parent in a vegetative state. And I was present in that room, so I listened to their discussion. I mean, we couldn't help it. They had it in front of them, probably, so whatever. And there was a debate in the family. Should we keep her alive or shouldn't we? Logical question. It was clear that there was a divide in the family, but because I think they were less educated, and they certainly didn't have the faith we have, perhaps not full knowledge we talked about, the majority of the family wanted to keep her alive. She was in a vegetative state. They would have, the cost of this would have bankrupted the whole family. It was very clear. They were putting on the line everything to keep her alive for an indefinite period of time, which they didn't know, and which would have bankrupted them. Is bankruptcy a consideration? I'd like to ask you all here, do you think that's a consideration? Most people, first reaction is no, it shouldn't be. But when I say vegetative state, we're not talking about just food and water. We're talking about ventilators. We're talking about tubes. This is the extraordinary means stuff. Okay. So how do we make a decision on all these double effects? Bankruptcy, narcotics, double effects. Well, the church has a wonderful set of principles to follow. And what's interesting is these are very similar to the principles of a just war. In fact, they're a just war. That word is a just war. In other words, how do you determine a war is just?
War.
War.
W-A-R.
W-A-R.
Gotcha. Thank you.
And so these are very similar to that, and that's kind of where they came from. Okay. The person who really came up with the just war theory was 4th century he wrote the Confessions. Not Aquinas, he's 14th century. Augustine came out with the theory of just war, and it's very simple. So let's go through it. Double effect. The act or the omission can't be evil in and of itself. Well, that seems pretty sensible. And I'm not going to talk about the just war theory because it's a different subject and it's similar, but I'm not going to go into it. Well, basically, you can't do something that's intrinsically evil. So, you can't overdose them on narcotics. That would be evil. Kill them. Intentionally, you're intentionally killing them. The second rule is the intent must be good. So you can't withhold antibiotics with the intent of killing them. Now I realize that's a subtle thing, but we in our family had to search our soul. Are we doing this because we love our mother? That's not all. It's not just love. We saw the nurse screw up over love, misapply. Are we doing it to follow her wishes? Yes. Are we doing it because we want to kill her? No. There's a natural process happening here of infection, and we're stepping back and we're letting God. And we're not withholding food, we're not withholding water. Okay? Now, the intent was good. But let's say, these are all some factors. Let's say it's a 5-year-old child. Couldn't make that decision on their own. You have to decide. You bet you're going to give them antibiotics. It's not an 83-year-old woman who's been paralyzed for 8 years. She's had a full life, and she's told us what she wants. Okay. So, love is at the heart of this, but it's not just love, but it's reason, faith and reason. Another rule is the good can't result from the bad. The example I gave earlier was you kill the mother to save the child. And that's quite often misunderstood. People think, well, you've got to do that. No, you don't. Because it violates the double effect principles. The good must be greater than the bad. Well, and I'm sorry I used a mathematical symbol. That's greater or equal to. Greater or equal to. I put all the words in this like it's too good. I apologize. The good must be greater than or equal to the bad. So, the people who wanted to keep their mother alive, was the good better than the bad? I don't think so. Is it right to bankrupt families and children and generations to keep a vegetative state alive for 10 years? Now, what's interesting is the church doesn't take that example and take you to the penitential books and say, well, then you've got to keep the 5-year-old alive. It doesn't make statements like that. We're not talking about prescriptive approach or a subjective feeling approach. We're giving principles so that people are allowed to follow their conscience and do their best to make that decision. That doesn't mean that they don't consult with a priest, a doctor, etc. Because a lot of these are involving different fields.
Why was it then that when we had that woman that was on persistent vegetative state? I forget
In Florida? I remember, yeah, in Florida.
Yeah, and the church seemed to be supporting the parents who wanted to keep her, keep her alive with feeding, but the husband didn't want to, feed her.
Okay.
Why was that then? I don't know. Why did the church?
What's interesting that the church is kind of these principles and this whole thinking is evolving over centuries. That's the beauty of the Catholic faith. It evolves, and it's not just based on Scripture. We base it on people's learning and the inspiration of the Holy Spirit. Now, if they had come to a moral decision that they felt that they should keep that lady alive, and I don't know all their factors, then the church has to respect that. You can't go in and say you were wrong. Now,
but part of the family didn't want it.
Right, and that's why we're here today, is to try to get these things talked about amongst families with reasonable scenarios. Okay. Now, one thing that I was hoping would come up, and we've kind of brought it up, is, well, food and water, you can't withhold them. But people could be fed through food tubes, food and water. So that's an area where the church has said, be careful about this. Don't necessarily pull the tubes, okay, if that's all there is, okay. And so it doesn't mean that they've changed their principles, but what it does mean that you've got to pay attention to your thinking pattern when you approach these subjects so that it's done in a loving way, but also a very methodical way, because everything has a double effect. Everything. Did I answer your question?
Mm-hmm.
They're not going to come down and say, you got to do this. You got to do
I
this.
have a question similar to that, very basic. That is a feeding tube considered extraordinary means or ordinary means? Because it seems to me it's more extraordinary than ordinary. The person can't swallow.
I've seen the church talk about it in two ways, both ways. And the way I look at it, and I think the way we are justified in looking at it, is to follow the principles and be very sensitive about that subject, because if it's not that much effort and you're going to feed them, I think you have to do it. But if it means they're in a vegetative state and you're just keeping the flesh alive by doing this, that's another issue that I think has to have the double effect rules apply. You have to make a decision, because nothing is clean and straight. There are multiple effects that can happen. I don't know. I know I didn't answer your question, but people tend to want to have an absolute answer, and this end of life stuff is not absolute. We've got to weigh the issues.
I know a person, I know more than one person who decided near the end that they did not want to be fed. I mean, they were rational. They could make a decision, and death was inevitable, as you said, with regard to your father. But it was a question of not prolonging the death.
Well, if people make the decision they don't want to be fed through a tube, as far as I'm concerned, in terms of these principles, that's okay.
Because it's their decision.
It's their decision. Now, if you have to do this for a 5-year-old child, and they're in I'm thinking of extreme circumstances, where they're in a vegetative state, they look like they're going to be in a vegetative state, I don't always trust that the doctors can predict the future. So I think the double effect principles would tell me, not necessarily you or you, that you go the extra mile for a 5-year-old child. Who's to say that they're not going to pop out of it?
A miracle.
The kind of experience in this what we're talking about, my experience was that it's not solely your decision or your family's decision, because you have doctors. I mean,
That's
I
right.
marched up to the doctor with the paper and they said, well, we're going to do this. And they did what they wanted to until they finally decided.
Well, your comment leads into the next slide, and that is, you've got people to consult with. You're not alone. Okay? So this gets into the area of advanced directives. It's unfair, I believe, to a family to not have discussions with siblings, children and siblings, as to your wishes. Rule number 2 and rule number 3, remember? So it's not surprising that there would be what they call advanced directives. In other words, you'd say to people in advance, here's what I want, okay? Well, this is a list of some of the things, okay? And again, I'm not an attorney, and I'm not a doctor, medical doctor, but power of attorney is something that is signed quite often that would give power to somebody to handle your medical decisions. So power of attorney can be only strictly limited to medical, but it can also include financial. So that's something that would be part of advanced directives. The second is a living will. Now, this list is not mutually exclusive. Inside that living will would be a healthcare proxy. So I don't want you to think that each of these is mutually exclusive. Okay? But a living will basically says, I don't want these extraordinary means, and I'm making this decision as a 75-year-old person, and I have free will, and I don't want it. And you can't force people to take drugs if they don't want it. That would be wrong. And they have a perfect right to say I don't want it. Healthcare proxy, that's the person you're saying, I want that person to make that decision for me when I'm incapacitated. So if I become incapacitated, I want to appoint so-and-so as the healthcare proxy. That person will speak for me in making these moral decisions. Okay?
Excuse me, what's the difference between the power of attorney and the healthcare proxy when it comes to medical decisions?
Well, the healthcare and the power of attorney, and again, as I said, these are terms that are used, and I'm not trying to make the impression that they're mutually exclusive. Power of attorney is a very broad term, and it can apply to financial and medical. The healthcare proxy is strictly medical. Okay. Then you've got the HIPAA form. Now, HIPAA, in the infinite wisdom of our government, wants to protect us from everybody, okay, and wants to protect our personal information. And so HIPAA stands for Health Insurance Portability and Accountability Act, HIPAA. It can be a pain, let me tell you. But there's a form that basically relieves that pain a little bit, and I'm not super familiar with it, but it's part of the advanced directives. It would be part of your package. Living trust. Now, a living trust normally has two purposes, and most people think of only the first purpose, and that is financial. Okay, taking care of my money. But there is another purpose, and that is if you become incapacitated and you need your doctor's bills paid, who's going to do it? So the living trust gives the power to draw money out of your account to somebody that you trust, the executor, etc., and enables that money to be drawn out for your care. Okay? Now, if you don't have that, then you've got to go to, my understanding, again, I'm not an expert, you've got to go to court. Then you pay court fees, and you're into time frames, and if the person's dying, you don't want to sit there messing around with the court to give you permission to go in and get that person's money. So the living trust lays that all out ahead of time. Okay. Now, it does a lot of other things that are more financial, shifting money to from 401ks, and so you get less in the tax. And there's a whole other stuff, but that's not related to this talk. Okay? But that aspect of a living trust is important. Then it comes to the do not resuscitate, referred to as DNR. And these are the instructions that are in the living will, actually, and these are the specifics about, no, I don't want antibiotics. Okay, that kind of stuff. I'm going to go into DNRs in a bit more detail in the next slide. Emergency document access. This is incredibly useful. I want to tell you. My wife is having surgery. It's a true story. My wife is having surgery. We get done with the surgery, and the next day she's got a doctor's appointment because we've got to rush into something else, and we need the results. And I want the results. I want to carry them over. So, after the surgery, I go to the nurse station, and I say, you've got all the documents right here. I want to get a copy of those and take a look. Oh, sir, we can't do that because of HIPAA, right? Well, you'll find that HIPAA is a government requirement that is legitimately, it has to be legitimately enforced by the medical community. But you'll find that the medical community quite often uses it as a very convenient excuse to not have to deal with you, okay? And so the reaction was, as I expected, we can't do that because it violates HIPAA. I said, do you have a fax machine back there in the counter? Yes. Would you give me the fax number? Okay. So I take the fax number. And then I go to my service called DocuBank, and you'll see it down at the bottom, and there's a web page, www.docubank.com. DocuBank has my power of attorney, my living will, my healthcare proxy, my HIPAA form. They got it all. I call them. It's an automated system. I dial. I punch the numbers in. I say, it says first, they ask, what's your, this is what the card looks like. It's like $20 a year, $15 a year. Not too many people know this. I got it through my attorney, who's a deacon, actually, Al Vosick over at St. John Vianney. And I've maintained this. And so I go to the payphone, dial in my number, and then my PIN, and then I dial in the fax number for them, and then I dial in their phone number, which she also gave me. I sit down. Between 5 and 10 minutes later, I get up, I walk over there, and I say, did you get a fax? Yes, we did. I said, if you look at that fax, you'll realize that now you are required to give me this information. Oh, that's not our policy. And I said, you're going to be faced with liability if you don't give this to me. Now, I realize that that's not an issue you deal with as a nurse, but I would suggest to you that instead of sending you to the office, which is not open until Monday, you better call them. I think it's going to be in your best interest when you talk to them seriously and friendly. Calls, had the papers, walked out with it. This is indispensable. And I've used it a number of times. Doctors will not communicate with doctors or whatever. And so I've used it dozens of times. I said, give me a fax number. And with 5 to 10 minutes, they got 20 to 30 page fax. They get everything. It chokes them basically. And I said, you got it all.
What is this called?
This is, it's going to be in the handout. I'll give it to you, but it's at the bottom. DocuBank is the company. Now there are other companies, I think, that provide this service. So I'm not selling this, but it's the one I have, and it's indispensable. So I carry my wife's card, and the spouse should carry your card, your spouse, so that they can dial in your PIN. Okay, to get the information. But I carry actually my own too. I mean, I got both. So the last and probably the most important is talking about this with your family and your doctor, and being sure that you're on the same page. And it's not always an easy task for some families, but when I did it with my mother, it flowed naturally, and she was smart. She knew it was important. She was still mentally capable. So it's an important thing to do, and basically then go over these documents to be sure that they understand what's in them, and that they're the healthcare proxy and they better know it. You know, rather than find out when DocuBank ships the papers in, you know. Now, this DNR I was talking about is another subtlety that can cause emotional challenge. Every hospital, and I shouldn't say every hospital, but hospitals, different hospitals have different DNR forms. So you may have it as part of the documents you've shipped in. And generally there are 3 levels. There's full available treatment. You know, and no spare, no cost, do everything to save the person. There's partial, where you specify what treatments you don't want given. And then there's none. When I say none, now we're back to the ordinary means. You give them food and water, and that's it. But this oversimplifies it. Within partial, some hospitals will have multiple levels. So, and I see, I can't speak for all hospitals, but for our mother, there were 4 levels. And we weren't presented with those levels until after we got to the hospital. So having these, unless you got really good advanced directives, you might be thrown a curve. So you study them over, and they're not rocket science, they're not super difficult, they're not complicated, but it spells out. And the 4th level, the highest level, in this particular case with our mother, was no antibiotics. Well, we knew what that answer was. It was level 4. So it's a and there's one slide I didn't put in here, because, and I think it's best that I didn't, but that was to start going through all of the effects that you have to consider. And aside from the principles, everything's on the table. I mean, age, cost, wishes, extent of the treatment, and that's where the doctors can really be helpful. But my feeling is that when it's a younger patient, I go the extra 9 yards, even though the doctor may say, well, he's going to live for 6 months. Well, we've seen that, not always predictable. They can't always predict. But if the person's 85 years old, you have a tendency to believe it a little bit more. So I'm not saying you shouldn't trust your doctor, but I think medicine isn't so advanced that they can be super predictive. And so I tend to err on the side of conservatism when it's a younger person. Now, after the homily on this subject, I had a medical doctor come up to me and said, I'm a pediatrician, what do I do with children? Well, that's partially a legal answer too, but the Catholic Church traditionally has said, well, when you reach the age of 7, you can be confirmed and you reach the age of reason. Well, I've met people in their 90s that haven't reached the age of reason yet, so I don't know that that's perfectly an example. But the point is that you got to use a little judgment, and if it looks like the person's not making sensible decisions, or they're too young, or they're too dysfunctional, or whatever, you've got to be able to call on the advanced directives. Now, with a 7-year-old, most 7-year-olds don't have advanced directives, but that is a struggle for him. I can see where he was getting at, because he's dealing with probably not a 7-year-old, but a 14-year-old. And you've seen in the news them wanting to decline treatment. And so it's not clean cut. Legally, it's not. I'm not an expert. And so there it comes into how much influence you have over your children, and love, and hope that HIPAA doesn't get in the way. That's it. I think I did it in an hour.
So,
Do you have any questions?
say you have a complete, would the Catholic Church say that I could put in my advanced directives that I don't want to be defibrillated if I were to target?
Yes.
And that's full, that's okay with me, I'm not...
I think it's more important not just to say that the church would be okay with that, because that gets back to the penitential books, the prescriptive.
Right.
The church wouldn't say that they're okay with that or not okay with that. They would say, what we're encouraging you to do is apply these principles, and if you have applied these principles and you've come to that conclusion, we're going to respect that.
Right.
I mean, that's a different statement than saying, would it be okay with them?
Yeah, I know, and I...
Because then you get back into the penitential books, and we don't want that again, believe me.
But I'm surprised at how much, let's say, flexibility there is with regard to making the individual decision. That's the impression I'm getting, isn't it?
I think that if you have principles and rules, the flexibility that you're talking about is in the conscience of the person, and the fact that they try to do a good job. But if you're going to be the atheist that starves himself to death, I don't think that's flexible. But the church isn't flexible about that. But they're not going to condemn that person. So when you say it seems flexible, what do you mean exactly? I'm not sure.
I mean, I've been through an experience with someone, not to who chose to have water only and no food. And I was very surprised. But her priest was there with her all the time, and I just figured there's something there about this that I didn't understand that wasn't in business.
She chose no food.
All she was taking at the very end was water.
But she knew she was gonna die. I mean, she was in a,
She was not in a vegetative state. She talked to me. She appeared to be alert.
Well, how was she being fed? Through the mouth or through a tube?
At ice cream.
In other
Like a
words,
little cup of
so
ice
what I'm
cream.
saying is, she refused food because she couldn't eat it, or because,
I don't know.
okay.
I don't know.
What do you think was right there? What would you have done?
That was just fun. I value life so much. I wanted her to have hope.
It gets back to the principles, and if somebody comes up with that decision and they believe that they're right, even though you may try to talk them out of it, then I get back to this full knowledge, full freedom, and it's God's deal. I mean, you cannot force people. You can just give them the principles.
Listen to you talk about your mother and saying her age, she lived a good life, she was putting herself in God's hands. And I can apply that to this individual.
Well, but
Try to accept it.
if you want to follow these principles, you can't withhold food from yourself. You can't starve yourself to death. That's not morally right. But if she decided, and here goes the double effect, and why people want absolute answers,
Yes.
and it's not absolute, okay? Let's say when she swallows, it hurts, and she's refusing food. Oh, well, she's refusing food not to kill herself, but to avoid the pain. Interesting.
or could she be refusing food to avoid the pain of say she had cancer, or just somebody, or, I mean, to avoid
The nausea.
or the pain of the death of dying through the cancer, or whatever disease process it was. I'm saying,
It was one of those things where she'd been in and out of the nursing home, developed infections, and it just kept getting worse and worse and
Yeah.
worse.
But there's a tendency, I think, for all of us to try to call into other people's minds and evaluate whether they made the right decision.
Yeah, and
And-
I'm trying to say
and-
it wasn't my place.
Well, yeah, and I understand. And so, even though there may be a learning experience there, the problem is that we can't crawl inside their minds. Only God can. So all we can do is take these principles and apply them in a loving way as best we can. And the double effect. And everything has a double effect. So if you're not eating because you want to kill yourself, or you're not eating because you're nauseous from the chemo, are you, I personally believe you got to cut people a break. I mean, it's like this atheist. I mean, I'm not going to tell him he's sinning. I suspect his sister did, and that's why he rejected her. And all he wanted was love. All he wanted was hope and love. And if he doesn't want to eat, love him anyway.
Don't you think that the fact that whether death is inevitable plays a big part in that feeding and with the antibiotics and everything? I mean, if death is not inevitable, then it seems to me that there's more culpability. But if you know you're going to die in a week, or the doctor has said maximum a month or something, and
It's
different.
death is part of life. So I think we get so wrapped up in trying to prolong it that we can do crazy things. But it doesn't detract from some principles that the church gives us to be able to apply without telling us absolutely this is right, that's wrong. I I mean, we're not children. It's where is that in Scripture where it says, when I was a child, I thought as a child, acted as a child, then I grew older and I became an adult. And we're in adulthood, and we take the principles and we apply them. And if that person applied it and came to that conclusion, I think if I were her priest, I would try to cut her a little slack. Cut her a little slack. She's dying. Don't mess with whether she understands all the principles or all of the, those are the things you go through ahead of time. You don't do it on their deathbed. It's like this atheist. Getting into theology would have been nuts. I mean, absolutely crazy. I had a woman come up to me afterwards at a homily, chewed me out, chewed kahuna, and he said, it doesn't matter what you believe. Well, it does, but ultimately, God's going to be there for you, whether you believe or not. He's going to be there. That's for sure. Now, whether it's better to believe in that He's there, right? Obviously, it is. But we got to cut people some slack on their deathbed. Let's not get squirrely about this. We got principles, and we evaluate those before we get into that circumstance. And once we get into that circumstance, we hope that we have freedom of will. We have full knowledge and full freedom, and if we don't, God's in charge ultimately. We just try to do the best thing we can.
I have maybe an easier question that's not a moral thing at all. Is it possible to download any of these things off the internet? In other words, can it be done without paying legal fees? I guess that's my question.
I think there are locations to do that. Yeah. I would say that of all of those, the one that's probably the most.
Okay. This handout has a healthcare proxy in it. Okay, it's the Catholic one. Okay.